Hi, I'm Raina Morgan with iHealthTube. We're visiting with Dr. Hyla Cass. She's written many books. One of them is 8 Weeks to Vibrant Health. It's a book about women taking charge of their health. She's a practicing psychiatrist. She's also written Natural Highs, Feel Good All the Time. We'd like to talk a little bit with you, Dr. Cass, about your background and what prompted you to go into medicine in the first place.
I was really inspired by being the daughter of a doctor who practiced out of the house, took me on house calls, took me to the hospital, and I loved it. It was just it was my medium. I loved my daddy, and it just felt like a very natural thing to be involved with health and healing.
Okay.
And he had some really good things he'd say to us. There were 4 girls in the family, and if we hurt ourselves, or he would do the usual, kiss it better, and it'll get better. I mean, that was his words. It'll get better.
It'll get better.
And placebo effect, it works. Because most things do get better, and having that inspiration, that confidence that he inspired in me, oh yeah, it will get better. It would. Things get better, and we are so dependent now on pills. You pop a pill. That hurts, pop a pill. His motto, it'll get better. You don't have to do very much. You just have to pay attention. And then I actually had my medical education, even though I got a lot of it just right there in my own environment.
Hands-on.
Hands-on. Then I went to the University of Toronto. I did my undergraduate there and went to the University of Toronto School of Medicine, which was wonderful training. Very humanistic, very personally oriented. And the Canadian medical system is also a very good one, where there isn't the stratification that we have in the States.
Okay.
And I really received excellent training there. And then I did come to the States, to Los Angeles, where I did my internship. I did a rotating internship at LA County USC Medical Center, which was really trial by fire. It was intense. I learned gunshot wounds, diabetes out of control, people that were very, very ill with very difficult situations. Coming in, and I got a lot of good experience. Delivered babies, that was wonderful.
Oh,
I
you delivered
loved
babies.
delivering
Oh,
babies.
okay.
Did surgery. I mean, that was fun. I loved it. I mean, surgery doesn't sound like fun, but it really was. It was actually artistic too. They let me sew up.
So it was medicine as art. Yes.
Yeah.
Okay.
So I got to do that sort of womanly thing and not leave scars. The guys would just do these big, and I would do these gallbladders and just sew very neatly.
Oh.
So that was my surgery rotation. Then I did my psychiatric residency at Cedars-Sinai, which was affiliated with UCLA Medical School, and that was very inspiring. I had excellent teachers, and learned a lot about how to do psychotherapy. We weren't as much of a pill-pushing institution. We were not doing the big medication thing at that point. It was very much psychodynamic. And then I did a couple of years in child and family therapy, which was very useful. And learning family therapy, I learned about systems, and the systems approach, which is looking at the entire family, not just the identified patient, actually taught me about the systems of how we all interrelate with each other, with our environment, and how illness can happen. And how the systems of our bodies interrelate. So very interestingly, the systems theory and application I learned in family therapy really stood me in good stead in going into being more alternative. And then the alternative route happened really as an evolution of my psychiatric practice.
As your psychiatric practice.
Yeah, it just seemed I'd see what people ate, how they lived. If they weren't eating breakfast, if they were eating too much sugar, it was clear that they'd be anxious, they'd be depressed, they wouldn't be functioning correctly. And I began I started to do some reading, introducing better diet, adding some supplements, some essential fatty acids, just very simple interventions, and people would get better.
They would get better.
And I wouldn't have to do years of psychotherapy. I wouldn't have to give them an antidepressant. And that was so inspiring to me that became my path.
Well, thank you, Dr. Cass, for filling us in. That's an incredible background, and we really appreciate it.
Pleasure.
I'm Raina Morgan with iHealthTube.